Good morning and welcome to the Caregiver Teleconnection program sponsored by the WellMed Charitable Foundation. My name is Minerva Villarreal and I will be your facilitator for today's presentation. Today's expert presenters are Lucy Barylak and Elliot Montgomery Sklar, and they'll be talking about older parents caring for adult children. Now, let me tell you a little bit about them. Lucy Barylak is a social gerontology consultant with West Central Montreal Health in Montreal, Canada. Lucy is a renowned expert in caregiving, having won the Queen's Jubilee Award twice, presented by the Canadian Home Care Association. She has also been a family caregiver for her mother for many, many years. Dr. Elliot Montgomery Sklar is a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is a professor of health science at Nova Southern University in Florida, and he publishes and presents his work internationally, focused on the complexity of the issues related to aging and caregiving. And with that, take it away.
Thank you so much. Welcome, and I want to welcome everyone joining us. The landscape of caregiving among older adults in the United States has evolved significantly. And at one point in time, senior caregivers of adult children was mainly an issue if a child had a disability. But things have really changed with more seniors taking on the responsibility of caring for adult children who might have a variety of mental or physical health issues. So, our program today is focused upon the experiences of these caregivers, which might be unique, along with a lot of resources and tips to support them. We're also going to discuss some of the changes in our society leading to more senior parents becoming caregivers of adult children. And we're going to tackle some of the most challenging issues that these seniors grapple with toward the end of our program. We'll be sharing perhaps even more resources and information than we normally do. So please feel free to grab a pen and paper, but as Minerva said, this presentation will be posted. Now, usually we think of caregiving in the process of aging and illness. This role of ongoing caregiving for adult children is one that is not discussed as often in the overall space of caregiving. And we thought it was certainly an important topic for us to discuss because it brings with it a variety of different challenges, stressors, and emotions. Now, it's difficult to pinpoint the exact number, but a significant portion of older adults who are 65 and older are caregivers for adult children, with about 17% serving as caregivers for adult children. Now, these caregivers may experience higher caregiving stress, psychological distress, and also feelings of guilt when compared to caregiving for spouses, according to research from the National Institutes of Health. Some trends and interesting demographics include an increasing number of caregivers. So these are adults, typically 60 and older, who have been caring for adult children. This number has been rising due to improved life expectancy, societal changes, and better healthcare, allowing more parents to actually live longer to be able to provide care. But this is also true across the board, including people with all kinds of health conditions that are living longer than they did previously because of advances in treatments and lower mortality rates for many diseases. So, just as an example, 30 years ago, cancers of all kinds had much higher mortality rates than they do today, and there's been a shift looking to treat cancers more like chronic diseases. But with that can be more side effects, for example, that do require care. There's also a change in demographics. We've seen our aging population with baby boomers moving into retirement, and many of these seniors are caregivers, often balancing care responsibilities with their own health needs. Other shifts include younger generations like Gen X and millennials who are more commonly single and having less children than generations before them. And there are cultural and socioeconomic factors. Caregiving is more common in certain cultural groups where family responsibility is a central value. So, additionally, lower socioeconomic status can increase likelihood of people becoming caregivers because of more limited access to professional care services. And this is also true depending on the state in which you live. Some states have more social services than others. As an example, states like Florida and Texas have fewer social service programs than other states because we also don't pay state income tax. So you do get what you pay for in some cases. There are also a lot of gender dynamics. Women, particularly mothers, are more likely to serve as caregivers, which reflects broader societal patterns in caregiving roles. But this too is changing, and this shift in gender roles can make caregiving even more challenging. For example, if a senior male is caring for an adult child after his spouse passes away, he may feel even more isolated in his experience or unsure of what to be doing. So, if we look at some common health issues for which seniors are caring for adult children, these include mental health disorders like schizophrenia, major depressive disorder, autism spectrum disorder. But there can be some physical health issues as well, like intellectual and developmental disabilities, spinal cord injuries, and this can include other types of accidents, including traumatic brain injury, for example, multiple sclerosis, stroke, chronic illnesses like cardiovascular diseases, and also different types of cancer, as we discussed. Now, there may be certainly others not on this list. And a new area in which we find a lot of seniors caring for adult children is in the area of substance use. And some older caregivers manage care for adult children who are struggling with addiction and the recovery process.
Thank you for that, Elliot. I wanted us to talk a bit about guilt and stigma when it comes to caring for adult children, especially when it comes to certain health issues like mental health and substance abuse. I want to remind everyone that they are real health issues with biological, genetic, and psychological impact. There was an article published in the late February of this year in Psychology Today by Dr. Ruth Smith. This article touched upon some of these issues, and I want to read some of it for you. So she wrote, "What do you call a woman who is aged 60 plus years, has raised her children, is ready for retirement, and becomes involved again in housing and caring for her adult child with serious mental illness or substance use disorder? Some people may label her a codependent or an enabler. And she says, I object to these labels. Most reports on coping with mental illness focuses on the person with the condition. Very few researchers also explore the conflicts and feelings of older mothers and fathers who often become the default safety net for their adult children. These older adults reopen their homes and hearts to their adult children who are unable to sustain consistent employment due to their possible bipolar disorder or schizophrenia, or even maybe just depression or any form of a medical problem. The studies that do exist document how stressful the family caregiving situation can be. 8.5 million older adults in the United States are taking care of family members with mental illness, most of whom are adult children, financially dependent on their parents, many of whom also live with them. So let's look at some key points of the article that was discussed, okay? So what they're saying is the experience of older parents as caregivers is often overlooked. Vulnerable adult children often return home. When adult kids with serious mental illness don't see themselves as ill, their family struggles. And that's a real big one when the person themselves doesn't even acknowledge that they are not well. Older women still feel obliged as mothers, regardless of their and their adult children's advanced age, you know? You can, a child is always your child, no matter how old they are. There's a lot of guilt and shame that can come along with how we all cope with mental health concerns as a society. Frankly, the shame and guilt should begin how our health, we should look at how our health system has failed individuals with mental health concerns and their families. It's not easy to get services, and lots of people fall through the cracks. We do not have sufficient care for mental health, and we often view mental and physical health separately when they are so closely related. Many people feel uncomfortable discussing mental health issues or acknowledging that a family member is suffering. We know that caregiving can be isolating, and when you kind of not want to look at it, you kind of isolate yourself a little bit more because you really don't feel comfortable sharing, possibly with family or friends. Elliot and I have an entire program that is recorded and is dedicated to providing care for individuals with mental health issues that you can watch as a recording. So you can all very much look into that if you're interested. What we've learned for experience and research is that it's so important for these caregivers to have a space to share their feelings and their challenges. This
So,
particular
go ahead, Lucy.
Okay, thank you for that. Okay, this particular kind of caregiving stress is a significant issue, but there are strategies to manage it. So one of the most important one, which Elliot and I talk a lot about, is self-care. Prioritize your own health through regular exercise, a balanced diet, and sufficient rest. Mindfulness and relaxation techniques like practice meditation, keep breathing exercise, deep breathing exercises, or yoga can reduce stress levels. It really works, believe us. Set realistic goals and boundaries. Break tasks into manageable steps and set achievement goals to avoid feeling overwhelmed. Set boundaries to protect your own health and your well-being. Seek social support, engage with friends, family, or support groups to share the caregiving load. We also want to remind you that taking breaks and time for yourself is also so important. Whether you will go out for a 15-minute walk or just listen to music, whatever it is that gives you that little piece of time for yourself. Consider options like respite care services, temporary care options to give caregivers a break. Obviously, support groups are very helpful, both in person and online. What you're doing today is really something helpful, so I'm glad you're with us. Counseling, speaking with a professional counselor can be very helpful, or with a social worker, depending on your needs and your circumstances. Also remember that 988 is a crisis hotline that you can text or call at any time and can be extremely helpful if you need to vent or in the event of a true crisis. So keep that in mind.
I think many of us, we know these things innately, but it's important that we're reminded sometimes. And I think that that's very helpful. One of the things that you mentioned is also talking about your experiences. So why don't we see if anyone would like to share anything with us or has any questions about anything that we've shared?
All right, everyone. If you'd like to participate, go ahead and unmute yourself. I'll be able to see who has done that and we'll give you a call. Or you can go ahead and type everything in chat. Please participate. Your participation makes these presentations great for everyone who watches them in the future. Belinda, go ahead.
Can you go into deeper into codependency? Because I'm often told that I'm being codependent, but if I wasn't there, they would be homeless.
Yeah, it's a fine line that you have to live by. It's true. Um, and I've had the experience of working with caregivers who are caring for older adults. I think what is important to keep in mind is that there's two people in this relationship. There's you and the person you are caring for. Yes, that person may be your adult child, but you need to take care of yourself as well. So, and the balance also is to, and we're going to talk about it, so I don't want to go deeply into it, because Elliot will certainly describe it, and so will I. The fact that you're aware of that is the first step into kind of looking into that. So I don't know if you want to elaborate a little bit more, Elliot, or we'll just do it as we go along. It's up to you.
Or Belinda, if you want to share any more information with us that can help us in answering your question further as well.
Well,
Yes.
I'm just, I struggle because I guess I can see some elements of codependency, but, at the end of the day, I go into my faith, and we're supposed to help those that are sick, and mental illness is a disease, and it does have a stigma out there that a lot of people don't understand. But at the end of the day, it is somebody's husband and wife, son, daughter, brother, sister, friend, cousin, and it they're a person, and they deserve some gentleness, in my opinion.
And some grace,
Right.
as you mentioned, Faith.
Yeah.
I think we define codependence as two people getting something out of that relationship. And, my question to you to reflect upon would be, what is it that you're getting out of this? If your loved one is seeking help, is trying to help themselves and manage their health condition, and if you're supporting them in doing so, to me, that's something admirable. That's not an indication of codependence. So, I think that that's something important to reflect upon. And as Lucy said, we will talk a little bit more about this during our program. But it is an excellent issue that you bring up, and one that I think if you find support groups that are specific to caring for adult children, and some of the resources we'll share, this is an issue that comes up quite often.
Yeah. For me, it's a lot of aggravation and frustration. If I'm
Absolutely.
being, totally honest,
Sure.
because you know the capabilities, but you also know the disease is getting in the way.
Hmm. Absolutely. And I think to Lucy's point, you seem to have that ability to see that with some clarity, which is very helpful, because it's important to recognize the symptoms of the disease as being different than necessarily the behaviors or the actions of the person.
And as long as you can be very honest with yourself and not give up on your life as well, and be able to balance it. And we will talk a little bit more. And at the end, we'll have an opportunity to discuss things if you feel we have not answered your question. Thank you, Belinda, for that.
Thank you.
Thank you for sharing with us. Anyone else before we move forward? All right, well, if anything pops up, you can also use the chat box. I wanted to talk about some trends and demographics that I was speaking to a little earlier that are really contributing to the rise of older adults becoming caregivers for their adult children. And it's not just about obvious things like more people being sick. It's important to understand the landscape of why things are shifting, especially if you're a caregiver, a healthcare professional. It can really help to provide some perspective. So we have rising healthcare costs and a shortage of healthcare workers. We've had a shortage of healthcare workers for the longest time, but COVID has really changed things. A lot of people that were going into the health professions veered away from it. And as a result, 5 years later, It is making things more difficult for families to access care, to afford professional care, and it's also leading to more reliance upon family members for caregiving. If you are old enough, you recall what was known as the sandwich generation. And that was what was referred to caregivers who were baby boomers, who were caring for older parents at the same time as caring for children. Now, many find themselves in the sandwich generation again, balancing the needs of their aging parents with the needs of their own children. Now, this was true for baby boomers, as I said, but now many of these boomers are caring for their adult children and even their children's children, their grandchildren. A large number of older adults became caregivers to grandchildren if their parents passed from COVID, as an example, as well. So there has been a big shift, and it's still a sandwich generation, just a different kind of a sandwich. Now, there are also more mental health challenges. Younger adults are increasingly facing mental health challenges or being more open about them. And they often rely upon parents for support, seeking out professional help and receiving diagnostic evaluations. Diagnoses for anxiety and depression are way up. Now, we know a lot more about mental health than we did decades ago. And there are many more diagnoses out there than there were decades ago because more people are seeking out treatment. But there's also greater financial instability. Ever since the recession of 2008, there's been a rise in younger adults relying on their parents for financial assistance. And that can lead to increased caregiving needs. The pandemic was another blow to the economy and economic stability of a lot of younger adults, and many people moved in with their parents, as an example. Many have not yet moved out. There's a lot of changes to family structure. Um, as an example, I mentioned earlier that people are having fewer children, and that may also mean that the burden of caregiving may fall more heavily on individual children. Many older adults are also aging in place. Now, that can be a good thing, but at the same time, as I mentioned, it allowed the opportunity for adult children to move in with older family members. That happened during the pandemic. Many of them are still there. We know that it's very expensive. There's high cost of housing burden right now. Many younger adults can't simply afford to live on their own. So there's a lot of dynamics that change. And as a whole, we have increased life expectancy. So as people are living longer, the likelihood of aging parents providing care for adult children also increases. That makes sense, right? Along with increased life expectancy comes less acute illness and death, and more ways to manage illnesses for the longer term. We may be living longer, but not necessarily healthier. And this is one of the reasons, for example, that we see an increase in dementia and Alzheimer's as our population lives longer. Now, as Lucy mentioned, there can be a lot of stigma around the issue of caring for older children and not enough discussion. And that is exactly why we felt this was important to address. Older caregivers have a lot of concerns, and they're just as valid and based upon our changing health as well, and not just the health of our care recipient. So there's a lot happening.
That's for sure, Elliot. There's so many challenges faced by senior caregivers, but I want to talk about two in particular. There's a huge emotional stress of worry related to two major issues. One, who will care for my adult child if I no longer do so, get sick, or I'm no longer living? Or two, who will care for me if I need help as I age or if I get sick? So these are real issues that people are facing. So the answer to these questions, one of the answers to these questions are found in care planning for both the adult child and for yourself. And we'll talk more about these particular issues in a little while. However, it's important not to discount the emotional strain that these areas of stress can take beyond just the elements of planning. This can be among the most challenging issue for older adults who care for their older adult children, whether this has been a lifelong caregiving issue for your child or something more acute. It links with the common feeling of worry that many caregivers have, this feeling of immense responsibility and the uncertainty of what can or will happen if something happens to the caregiver. What is the safety net? Okay, the stress of caregiving often results in anxiety, depression, and caregiving burnout at times. So we know that. So I guess what I want to say to you, and I'm going to keep repeating it, so please remember, your needs are just as important as the person you are caring for. And I'm going to talk a little bit more about learning to say no as well. So with that, Elliot, I'll leave it to you now.
Before I move forward, I want to ask again if anyone wants to speak to their own worries or their own experiences.
I think I saw something in the chat, if I'm not mistaken.
It was Minerva providing information on how to access the foundation. All right, well, if anything comes up, you know where to find us. So Lucy talked about care planning. We're going to go through a ton of different resources. There are a lot, more than we actually usually share, because planning is so essential to ensuring that adult children continue receiving the care that they need, even if the caregiver's health declines or if they pass away. So here are some key things that you should be thinking about if you have not already. And the first is legal and financial planning. You'll want to establish legal guardianship. So if the adult child cannot independently make decisions due to physical or mental health conditions, caregivers should legally appoint a guardian. This legal process ensures that someone else can make decisions when the caregiver is unable to. In addition, a power of attorney is a legal document allowing the caregiver to designate a trusted person to manage both financial I'm sorry, and healthcare decisions on their behalf if they become incapacitated. Now, there's also something known as an advanced healthcare directive or a living will, which outlines a caregiver's wishes regarding medical care if they can't make decisions. And there is also something called a special needs trust. This is something that many of us have not perhaps heard of, but if the adult child has a disability, a special needs trust can protect financial resources without jeopardizing eligibility for government assistance programs like Medicaid or Social Security. That's very, very important. Now, you also want to update beneficiaries to make sure that designations on retirement accounts, life insurance, and other assets are current and reflect your current caregiving situation. It's also important to have a plan as a backup. So you might want to identify or put together a backup plan. And that can include determining who can take over caregiving responsibilities. That could be close friends, family members, or trusted community members. You want to familiarize yourself with respite care, as Lucy said. Very important during periods of prolonged illness or recovery, if you need it, as an example. In addition, long-term care services like assisted living facilities or day centers. If, for example, you might be in the hospital and you need to make sure that your care recipient has somewhere that they can be and you feel comfortable with that. Always important to have an emergency care plan, and we say this in any caregiving situation, but this includes emergency contacts, health providers, daily care routines, and specific needs of anyone that you're caring for. It's especially important with hurricane season coming up as well. If you live in an area prone to natural disasters and you need to evacuate, having this type of a care plan is very, very, very important. Now, people also assume that once caregiving is over, the stress from providing hands-on care will also go away. But researchers have found that even 3 years after the death of a spouse with dementia, for example, some former caregivers continued to experience depression and loneliness. So, in an effort to return to a life of normal, former caregivers may also need to seek professional help. And we talk about the importance of counseling. When you think about the amount of time that we spend on caregiving tasks, when that task no longer is needed, what do you do with that time? And that can be very important for planning for caregivers. Now, there's also importance in documentation and communication. You'll want to discuss future plans and have open conversations with family members about your adult child and the need perhaps for future caregiving arrangements, as well as that care recipient and caregiver's wishes. It's important to talk about these things, even though that might be difficult. Document care needs. Now, this is also very important to keep detailed records of your adult child's medical history, medications, care routines, preferences. Some people have binders and folders. This helps to ensure backup caregivers have access to these documents, so not everything is on your shoulders or in your head. And keeping a current list of healthcare providers, which can also include therapists and perhaps other specialists, and putting together community and support resources. We talk a lot about 211 in everyone's local community. And I spoke a bit earlier about how resources are different in different states. Some states have more social support services than others. So you can connect with your local agencies on aging, which can provide information in planning for future care needs and even in putting together all of these different planning documents. You can call 211 to get the contact information for your local AAA. Now, there are government programs, as I mentioned, like Medicaid. If someone has a disability, Medicaid will be their primary insurance most often, and that can also assist with long-term care costs. So planning is really important. But as Lucy said, personal health management is key. You want to make sure that you have regular health checkups, prioritizing your own health, especially as we age. That is incredibly important to have routine checkups. Many caregivers skip those, go without. Women who are caregivers often skip mammograms, for example, and it's so important to maintain your health, especially when someone else is counting on you. In addition, if you can, try to manage a balanced diet, regular exercise, and sleep, including some of the relaxation techniques that Lucy mentioned, and accessing caregiver support programs. You'll find that there are actually a lot of online support programs for caregivers of adult children with various needs. And some of them are really specific to what that need might be. These are great, great mechanisms for finding other caregivers, learning from their experiences. And we know that we always find caregivers have the most amount of information to share with one another that can be really helpful. Now, Lucy was speaking earlier about end of life planning, and that's a really hard one. Now, writing a will or having a will that clearly outlines, how you want care and assets to be distributed, specifically with regards to guardianship as well, and for care arrangements for that adult child, all of that needs to be detailed. There is also something called a letter of intent, which is a non-legal document. Again, this describes your adult child's daily routine, preferences, could include medical information, and anything else that might be vital for other future caregivers. You can also look into prepaid funeral plans to reduce any type of burden, including financial and logistical, on family members after someone passes. And it's so important to discuss these concerns and realities, if you have them, with healthcare providers, both your own and potentially your child's, to discuss care transitions so that healthcare providers can help planning for transitions and can also recommend appropriate services. And palliative and hospice care. If the caregiver or care recipient's health is terminal or declining, these services can support both in the process and often include counseling as well, which can be very helpful. Any way you go about it, planning ahead ensures that you relieve yourself of some level of anxiety by ensuring that your adult child's needs and care continue seamlessly, and that you're not faced with making last-minute decisions during crises, which we know can be very challenging. So I know I shared a lot of information, and before Lucy continues, I just want to ask if anyone has any questions or comments.
Everyone, please go ahead and unmute yourself if you have any questions. I do have one question that came to mind. What resources are available for a single family unit? You have like the mom whose husband passed away already, taking care of the child, but they don't have any other support system around them. What are the options available for someone in that type of situation?
It's a great question, and it really would depend. It depends on where you're living, because as I mentioned, not all state support services are equal, and that trickles down all the way to the county level. But I would say that it's important to also take into account if that person has a faith-based community that might exist around them. That might be somewhere to look for support or referral. Additionally, calling 211 in any community is such a great resource. I'm an educator, so to me, doing your homework is an important one. And knowing what resources exist in your community is important, even if you don't need them right now, so that you have a list, you have some resources down the line in case you need them. And that's why I say it's great to have this information so that you don't need to make last-minute decisions in crisis. And really, the role of social workers is to fulfill, Minerva, the question that you asked, to help identify what resources, what supports, what services are needed, and how to align people to those if possible. But we know that it is sometimes hard to access services, and it does very much depend on where you live.
Thank you for that. Anyone else have a question or comment?
Lucy, were you going to add something to that?
No, I was just going to say all these, that it's really important to, you don't have to do this alone. That's what I want to say. So outreach to your community, whatever it is, to try and get the support that you need.
Absolutely, and doing it proactively and preemptively. Like as I was saying, Minerva, finding connections through community organizations or through faith-based centers or health facilities. Making these connections earlier is very important. What's also found is that caregivers of adult children experience even more isolation because they don't want to discuss their situation. They don't want to be labeled by other people as codependent, as an example. And so for male caregivers, some of the research showed that even interacting with a store clerk at checkout, hi, how are you? That actually had a positive impact on reducing isolation among older male caregivers because of that isolation. So building networks, building community, it's very important.
Absolutely. So thank you for that. I'll just continue. So we know that as a caregiver for an adult child, it's so important to prioritize open communication and set realistic expectations for yourself and for them, okay? And again, as we're talking, seek support. You don't need to do this alone. And remember to practice self-care. I'm going to keep saying it over and over again, because so many caregivers just give up on themselves. It's really to prevent burnout while respecting your child's autonomy and preferences. Even if you may not necessarily agree with them, as long as you feel that whatever they're doing keeps them safe, please encourage autonomy, all right? And just try and sort of step aside a little bit and give them that space. So as I said, communication is key. Open and honest dialogue. Establish clear and open communication channels to discuss events, concerns, and expectation. You may also want to do it like something you do every week. You know, it's time to sit down. Let's review what has happened. What are we talking about? But the other thing is active listening. Active listening to your child's perspective and concerns, validating their feelings and experience, and not challenging them. I have to say that you're not there to fix them. You can't take the problems away. It's a two-way situation. You're both working together. Another good tip is to regular check-ins. Maintain, if you're not living with you, maintain regular contact to stay informed about their well-being and address any issues promptly if you see something is really going wrong. The other thing is really looking at setting realistic expectations. Focus at what you can do, all right? Acknowledge your limitation and focus on the tasks and responsibilities you can realistically handle. I want to tell you that it's okay to say no, all right? You have to kind of know when to say no. Seek help when needed. Now we're talking about that. So please don't hesitate to ask for assistance from family, friends, or professionals or other caregivers. Be flexible. That's one thing that's so important, even in my own caregiving journey. Be prepared to adapt to changing needs and circumstances as caregiving situation can evolve. It's a real journey that's up and down. Respect autonomy. Encourage your child independence and involve them in decision-making as much as possible. Sometimes we're caregivers, we want to protect them, so we take over too much, and that's not a good thing. Prioritize, and repeating it again, self-care. Take breaks. Schedule regular breaks and engage in activities that help you relax and recharge. And you know, for me, it's listening to music, whatever it is that you need. Seek support, connect with others, as we said, so that you don't feel isolated and alone. Practice self-compassion. So important. Be kind to yourself and recognize that you're doing the best that you can. Elliot and I always say, there are two people in this relationship. One does not outweigh the other. So if you made a mistake, forgive yourself and tell yourself that you're doing a good job. Maintain your own health. Now that is so important. Prioritize your physical and mental well-being by eating well. I know Elliot talked about it, exercise and getting enough sleep. Reach out to others, and again, try and sort of recognize that you have a life to live as well.
Beautifully said.
Thank you. So maybe having said that, does anybody want to comment on that, or you want to share maybe a tip that others would find helpful in their caregiving journey?
Hi,
Hi.
this is Banu. Can you hear me?
Yes, we
Yeah.
can.
Right. I'm 90 years old, taking care of my 65-year-old multiple sclerosis patient for the last nearly 30 years. As he gradually declined, we still live together. He lives with me. I'm a widow now. One of the things which I found is so that we both are not alone and isolated, I find an excuse to invite a friend or a relative or somebody every 10 days. They come home, even though a little extra work for us, order some food, and they spend time with us. I find that very, very emotionally happy situation.
Wow, thank you. That is so encouraging. And you've been doing this for a long time, and the fact that
Yeah, I have all the systems help in place, what you've been teaching today.
Wonderful.
Luckily or unluckily, I'm a retired social worker, so I'm familiar with that. Right. Thank you very much. It's a very well presented.
Thank you. And thank you for the role that you provide and the care that you provide, and for that wonderful tip. I think having visitors come by is an excellent idea for both the care recipient and the caregiver.
Thank you.
Yeah, and I give you kudos.
Amazing.
Thank you for that.
Anyone else?
I see Dawn, you're unmuted.
Yes, thank you. I hope you can hear me. I actually am in the car because I was actually driving to my counseling session. I'm a little bit different. I'm going to be 61. My daughter, we thought, had some mental health issues, postpartum depression, but at age 29, she was diagnosed with frontal temporal dementia, and we became her caregiver for 4 years before she passed away, unfortunately, at 33. The comment I want to make, I appreciate this this presentation, and I wanted to say, especially with someone when you realize they have a terminal or incurable disease, as she only lived 4 years, it was really important that knowledge is power, and learning what you're dealing with, finding those that understand, who've walked that path, and also learning to take each day and find the joy. I always looked at it as there's two sides to every coin, and it's difficult for us as caregivers, especially as parents, watching our child decline. To the last 2 years, she couldn't speak, she couldn't feel pain, she couldn't smile, she was totally dependent, though she could walk, and swinging was her favorite activity. But I think it's finding that joy and seeing it wasn't easy for us, but it wasn't easy for her either, and respecting that, that we could still find joy in the simple things of the day. And I that's just something that, now that it's been over 2 years, I, as a mother, am grieving her. But we have so many amazing blessings during her time that she basically reverted back as a child. But I'm also caregiving for my elderly mother-in-law, and I cared for my parents. My mom died 5 months after my daughter was diagnosed. So it's very important to find the details of what your loved one, whether it be an addiction, just finding what works best for your situation. Does that make sense?
Oh, well,
Absolutely.
does that make sense? That's very, very powerful. And I'm sure for others listening, it touched my heart. My condolences to you on the passing of your
Yes.
daughter. But the fact that you were able to find joy and stay in the moment, that's not an easy thing to do, but it's a blessing, because that's what it's all about.
Yes.
Exactly what you said. And I'm so happy that you've come to that conclusion for yourself and for your daughter, and just in general. We really have to live in the moment, and we have to find the joys and see the cup a little bit more full than empty.
Yes, I actually found a gratitude journal to be very helpful. My faith is extremely a part of me and my life. I've lost a lot of a lot of people I loved in the last couple of years, and watching my daughter go from a wife, a brand new mother, a nurse, to totally someone that, couldn't even, she knew us. We learned that love needs no words. We found ways of communicating, human touches. She loved to hug, she loved to hold hands. And I think that you meet people where they're at. And she taught me more than I probably ever taught her in her life, because she taught me to slow down, to be grateful, and to look at that. Every morning I would try to do a gratitude journal, and I could talk on and on. I actually I'm a part of the AFTD as an ambassador and share my story, but I just want to tell you how much I appreciate this program, because there is a different dynamic when it's your child, versus, because I've dealt with so many others, siblings, I've lost parents. So I think it's very important for older adults dealing with your adult child, because they're your child no matter what age they are, and you can find joy if you look for it.
Thank you
I
so,
want
so
to thank you.
Well,
Thank
thank
you
you for allowing me
so,
to
so
share.
much. Of course, I'm honored by your candor in sharing with us, and my deepest condolences to you. And what an incredible tribute you shared with us. And I'm sure it touched many people participating as it did Lucy and I.
Well,
So
I truly appreciate the opportunity.
of course, absolutely. I want to be sure that I cover some important resources to share with all of you before we pass it back over to Minerva, because we have so many different resources. But some of them that we have talked about, like 211 and the 988 crisis line. The Family Caregiver Alliance also has some information on their websites about older caregivers caring for their children or for others, as well as the National Alliance on Mental Illness. They're at NAMI.org. They have a lot of resources, especially for caregivers of adult children. And then we broke it down as well into some hotlines and helplines. The National Family Caregiver Support Program can be reached at 1-800-677-1116 to help you in finding local support, including counseling, respite, and financial assistance. And the AARP actually has a lot of information about caregiving as seniors for other adults, seniors, children. They have a tremendous amount of information on their website, and as always, the WOMA Charitable Foundation. And with that, I will pass it over to you, Minerva.
Thank you, Elliot. You will notice there will be a pop-up, and that's our session poll. This is how we know what your thoughts are on our today's presentation. I want to say, please go ahead and fill that out. This helps us a great deal, and we also lets us know what other topics you might be interested in. And on that note, we are just in the beginning of April, and we do have other teleconnection sessions coming up. And the next one that we have coming is, so sorry. It's going to be on Thursday, April 10th. We have communicating strategies across the stages of dementia. That's going to be with Holly Glover. We also have on Monday, April 14th, programs that can consider family members as paid providers with Donna Green. And then on Tuesday, April 15th, we have what we learned from Hackman, planning for caregiving emergencies, and that's going to be with Barry Jacobs. I want to say thank you for all of you for everything that you do, everything that you provide. You are appreciated, and you, whether it's been said or not, you are been loved. And with that note, I also want to say thank you to the WellMed Charitable Foundation for providing these programs for everybody to enjoy and be able to learn and connect and get something new from them. Lucy, Elliot, any final words you would like to say?
Well, somebody said that the survey disappeared before they can fill it out, so maybe you want to put it back up.
Oh, yes, let me go ahead and start it up again. I don't know why it does that sometimes.
But we do have a few minutes, Elliot. Is that okay? If anybody wants to ask another question or give another little tip, that's always so helpful.
I just want to thank those who participated today and who shared with us, and thank you for the role that you serve as caregivers. You're integral, and we appreciate you.
Same goes here. Thank you so much for everything that you do.
Okay, the poll should be back up.
Yes.
So sorry about that. I think sometimes if someone clicks out of it, it'll stop it. Anybody else have any questions, comments they would like to share? We have 5 minutes left before we have to close this session.
Okay.
All right
All
then.
right. Well, thank you all so much. Wishing you all a wonderful day.
Same goes here. Take care of yourself. Remember what we said. Bye,
Bye,
everybody.
everyone.
Bye, everybody, and thank you. I will stay on with the poll.